This is the Real Grand Podcast. Welcome home. All right, guys. Well, welcome back. Good morning, good afternoon, good evening. It is another week on the Real Grand Podcast. And it's a good day because it's a day that we are going to learn about some stuff that we should probably have known about since forever, but most of us don't. We're going to be talking about dental hygiene. So yeah, woo! Right, that's fun. So we're going to be talking about dental hygiene with Miss Arianna Cazares, registered dental hygienist, also known as the RDH on Instagram, which is how we found her. So thanks for being here.
Yes, thank you so much for having me.
Yeah, it's an important conversation to have. It's interesting. A lot of us, have probably spent some time away from dentist's office, and then of course there's the other percentage of us that are afraid of going to the dentist.
Yes.
So it's a big deal, and I like that. I wanted to have you on because I really liked your Instagram account because we were talking about it off mic a little while ago. And in the valley, nobody's doing this, and we're not being taught. And if we're not going to the dentist in the first place, well, then we're not gonna know what we should be doing or keeping up with our dental hygiene, which we're probably all guilty of from time to time. So before we get started talking about what you do, about tips and things like that, let's talk about you first. So tell us about yourself. And that could mean whatever you want it to mean. You could tell us about your childhood. You could tell us about how you started your career. Tell us about you.
Okay. So yes, I was born and raised in Edinburgh. I am a first generation college student. And also I have 2 degrees. I have a bachelor's in biology from UTRGV. And I have associates in dental hygiene from TSTC in Harlingen. I just started my career in June. So I just graduated. I'm fresh out of school. And I love it, and I'm happy to be here teaching you all about the importance of oral health care.
Yeah, and that's awesome because we need that, we said a little while ago. So, why did you start? Why did you choose dental hygiene as a career? Because that's dental hygienist is one of the careers that we don't hear a lot about, even in school and stuff like that. So how did you find it? How did you choose it?
Yes, so I always had a great time at the dentist, and I know a lot of people might have different point of views or different experiences, but luckily I had a great time at the dentist, and I always enjoyed going to the dentist, and I always asked questions, and I knew I always wanted to be in some type of medical field when I was younger, and I just was geared more towards dentistry. And luckily I got to shadow my dentist and see her side and also the hygienist side, and so I went to school for that, and then I kind of geared pathways because I realized that I wanted to give back to my community a lot. And by doing that, I saw that there was a need for more of the prevention side because dentists do more of the treating already when there already is an active disease. And hygienists do more of the prevention, the more community outreach. So that's what geared me towards that. And then I applied to TSTC, and then I'm here.
That's cool because you really made it happen because you said you finished in June, right? And
Yes.
You've already started. I saw that you were working with Texas Mission of Mercy, the nonprofit.
Yes.
So what's that all about? How did you get involved with them, or what did you do?
So I've always followed them. A few years back, I did volunteer in Corpus at an event that they had there. And we had never had a T-Mom, it's called Texas Mission Mercy T-Mom event here in the RGV, and they finally had one. And as soon as I heard about it, because they had announced it about a year back, and I signed up right away as soon as I could. And I was glad that I was able to volunteer as a provider and actually treat people compared to a few years ago. I was just a regular volunteer, giving back to the community. So, I was glad to do that.
That's good timing then, right? Because you had you just got it done, and then they're coming here.
Yes,
that's cool.
Yes.
That's fun, actually. So, okay, so let's get down to the nitty gritty, right? Some interesting stuff. So we were going through your account, and that's what your whole Instagram is too, right? The importance of hygiene and just educating us on things that I guess nobody really tells us. And we were talking about that. So let's talk about I was thinking toothbrush talk. Right. I'm going to ask you because I've heard different things. So before we get into other stuff, this is more like for me personally. Like, how often should I be changing my toothbrush? Is it true the 3 months?
Yes, every 3 months for sure. Or when the bristles are flared out, and that's also a sign of you brushing too hard when the bristles are flared out before the 3 months. Or whenever you're sick, because that bacteria still stays on the toothbrush. So once you start feeling a little bit better from whatever you were sick from, you want to toss it out and get a new one.
Really? So if I had the flu, I should be changing my
Yes.
toothbrush?
The flu, common cold, maybe even a sinus infection too because of the postnasal drip and all that.
Oh, wow, man.
Yes.
We'd never thought about that.
Yes.
Okay. So so the 3 months is kind of like if everything went right,
Yes.
then by that point, that's like,
Yes.
you change it out already because it's been long enough. Oh, okay. But there's a lot of things that can make it even shorter then.
Yes.
And then I like what you said about if the bristles are all messed up, because like I think we've all had the toothbrushes where like we look at it and it looks like somebody had a bad hair day.
Yes.
Type deal. Okay.
That's a sign of an aggressive brusher.
Aggressive brusher.
That's what we call
Okay.
them. Yes.
There's a term for that?
Yes.
Okay. So then talking about toothbrushes, this has been frustrating to me because sometimes I'll get home and I don't even realize that I got like, according to me, the wrong one. But like, what's the deal with like soft, medium, hard toothbrushes? Is there one that we should be going for? Is there a right answer?
Yes, for sure. You want to go towards soft or extra soft toothbrush. Stay away, please, please, please stay away from medium and hard. Those are meant for cleaning your rings or the grout on the floor.
Okay.
It can be too much. It's too much damage to your gums and your enamel. And over time, it will wear them away.
So then it's not right to think that we have to brush harder with a harder brush to really get in there. We should
No.
not be doing that.
No, it's all about the technique, honestly. And you just have to do a little bit of pressure. And you can watch my videos for some tips on that. But yes,
Okay.
yes.
You said technique. So you mean like the way that we're supposed to be brushing our teeth?
Yes, correct.
Okay, so how should we brush our teeth?
So, for instance, I know a lot of us here, it's kind of like a domino effect, but we were taught by our parents who were taught by their parents and so on and so forth that we brush in circles. That's more of a child approach, what we teach them because they have limited dexterity. So you stop at about 10 years old of the brushing in circles. So most people, there's so many different toothbrushing methods. So you just ask your dentist or your dental hygienist. But the most common one, you want to brush back and forth at a 45-degree angle towards the gum line. So it's important that the bristles go a little bit underneath the gum line. And then you want to brush away from your gums to brush the bacteria away from the gums.
Okay, that makes sense. Yeah, from dirty to clean.
Yes.
Type of deal. Man. So we're brushing in circles like in our 30s and 40s. We're like 20 years like past.
Yes.
Oh, man.
Yeah.
Man, you see, nobody tells us this kind of stuff. Huh. That's going to make a lot of us think like how we're... So then it should be just like straight lines, like you said, like...
Yes, straight back and forth, side to side a few times, and just make sure the key is to keep that 45-degree angle.
Okay, so then like, is there... I mean, when should I ever use a hard toothbrush then? Like, no, right?
No, never.
Okay.
Please, no.
Why do they exist then? Like,
I have no idea. I guess just marketing and just trying to sell things.
but it's just not like it's not healthy. Like it's literally
At
doing
all.
damage.
Yes, it's doing damage. It's wearing away that layer of enamel, and then
What?
over time you could be more prone to cavities because you're losing the minerals in your teeth. So, and the minerals are what helps keep it strong. And so, yeah. And also it can actually cut up your gums too.
Oh yeah, like where you spit some blood and all
Yes.
that. Okay, so it has to be soft.
Yes. Or extra soft.
Okay, do you are you a fan of the whole like electronic like automatic ones?
Yes. I love electric toothbrushes. I use one myself. Like I said, it's all about technique. You can still do a good job with a regular manual toothbrush, but like I said, technique is key. And like I said, also a lot of people don't know how to properly brush. So electric toothbrush would do a lot better than a manual for them.
Okay, so let's talk about something that we probably need to talk about too, flossing. That's one thing that I feel like everybody hopefully is like okay with brushing, right? But flossing is like
A whole other ball game.
yeah, like how regularly should we be doing that?
Every night, at least every night. You can
Every
do it
day, every night.
Yes, every day, every night. So you can do it after a meal if you want, but for sure at nighttime, because think about it. This is what I like to explain to patients, because even patients don't brush at nighttime. They'll just brush in the morning. And there's also a saying that says you brush at night to keep your teeth and you brush in the morning to keep your friends because of like bad breath. So think about all the foods and drinks you consume during the day, and then you're going to sleep. Most of the time you sleep with your mouth closed. It's a hot, moist environment. Bacteria thrives on that. So your bacteria is just growing and growing, and then it can lead to cavities or gum disease.
Okay, so like that's with brushing, right? Like if you don't brush at night.
Yes, and flossing.
So what, like if I didn't floss or if we don't floss, those are the like does that cause cavities and stuff like that, or like?
Yes, so cavities and gum disease. So I know a lot of us here just think of cavities, but there's also gum disease, also known as periodontal disease. So, and also what I've seen with patients is a lot of time they just kind of pop the floss in and out, which is good for the contact between the teeth, preventing cavities. But the floss is actually supposed to go a little bit below the gum line to take out that bacteria. So that prevents periodontal disease. So like I said, you have to angle, like forming a C shape, hugging each side of the tooth and then taking out the floss.
Can you guys tell if we're not flossing?
Oh, yes. We just like to ask you just to see whether you're lying or you'll tell us the truth. But we can definitely tell.
Like it's obvious.
Yes.
Like, and what are you seeing? Like what tells you that I haven't flossed in months?
Bleeding and puffy gums. Bleeding is not normal. Everyone, please, bleeding is not normal. I know a lot of you might have been taught that, or, it might have been just what you've heard, but it is not normal at all. It's a sign of gum disease, and which, if it's not prevented or treated, eventually can lead to tooth loss.
Oh man! So like flossing is no joke. Like we should, like it's a must.
Yes.
Like it's not an option.
No.
Okay, man. Does it matter like those, as long as it's floss, right? Like some people use like the string, some people have like the sticks. Like doesn't really matter. String
is always a little bit better, but whatever makes you happier, whatever is easier for you, because I know some people have dexterity issues. At least if you're getting something in there.
Okay, man, you're getting us thinking already. So that's like with the teeth, right? But what causes and I know I saw it on your page too, but what's up with the whole thing where people have like stuff on their tongue? What's up with that?
Oh, coated tongue. So or white tongue. It can also be yellow or black. They call black hairy tongue too. There's a lot of different things. They're all from different sources. So basically, if you think about it, you can be brushing and flossing your teeth, but if you're not removing that bacteria from your tongue transfers the saliva everywhere throughout your mouth. So you could have just finished brushing and flossing, but that saliva and that bacteria that's on your tongue, it's going to transfer all over again. So yes, you removed most of the bacteria, but the stuff that's on the tongue is still going to be transferred again, all over again. So we want to clean the tongue. I always recommend a metal tongue scraper, metal over plastic, because metal tends to harbor less bacteria. And it also helps improve your taste buds, your taste enhancement. It helps with bad breath, of course. And there's also other benefits from it.
Okay. And yeah, you said the bad breath. That's the whole tongue, right? That's like the whole tongue issue. Mm-hmm. Like that will make, like if your tongue is, there's a lot of bacteria, that's what's going to cause the bad breath, right?
Most of the time, yes, but it can be gum disease and cavities. Like, I don't know if you've heard people say like, oh, you can smell that they have a cavity.
Cavities can make your breath smell bad?
Yes.
Because of the bacteria,
if it's really
right?
bad, yes.
Yeah, that makes sense. And of course, I'm playing the role of someone who knows nothing. Not that I do, but like we're gonna ask like probably the most basic questions, because it's at least to review, right? These type of things. Because the tongue one is interesting because like maybe we're brushing, we're flossing, but like how many of us are scraping our tongues, right? Like I've seen, I've talked to people like like we don't even always have like a apparatus to do that, like because I know a lot of the toothbrushes have that thing. Is that good enough too? Like on the other side of the brush?
Yeah, the back of the bristles. So a lot of people, or recently there's been studies that say it's not as effective, that it's kind of just moving it around and it doesn't fully remove it.
Okay.
So that's why I always prefer a metal tongue scraper. And I just search on Amazon metal tongue scraper, and it's the number one or bestseller. That's the one I always recommend. So
Okay, so if our listeners right now are like, wait a minute, press pause, they go to the mirror and they've got a coated tongue, do you have to get that treated, or can they just get that thing and do it themselves? Like, is that something that you need to go to make an appointment for?
it just depends. If it does start removing within a week or two, I would say about a week or two of you using a tongue scraper, I would say it's normal, but sometimes even medications have been caused to that, or it can be an underlying health disease, like kidney issues or maybe even heart issues. So, and it can also be, it's oral candidiasis actually. So if it's really, really bad and it's been there for a while, you might even need medications prescribed.
Okay, yeah, because that's what I was thinking, the whole yeast and the
Yes.
the thrush.
Yes.
Okay. Yeah, because like sometimes that's actually a yeast infection, right?
Yes,
Like on your
it is.
tongue. Like
Correct.
literally. And so at that point, how do you know if it's that? Like, how do you know if it's just that, like, you just need to scrape it, or if it's legitimately like a yeast infection?
The
Like
dentist, with you scheduling an appointment, they'll be able to tell you. And like I said, just wait a few weeks to see if it goes away or not. And if it doesn't, most likely you will need.
So if your tongue is still yellow or white after a couple of weeks,
Yes.
go get it checked out.
Yes.
Okay, and that's easy one to spot, right? No one's gonna miss that, right? Like,
Yes.
you gotta, or at least I don't know. I think we all look at our tongues. I think we all do. Hopefully, right? I think everybody does. Even to check it, like, oh, does it have? Is it blue from the soda that I just drank or
Or
something?
the lollipop that you just ate.
Yeah, exactly. Okay, so tell us about your Instagram page now, because we were just kind of talking about points about it, but like, how's that going? How's it going with the social media thing?
It's going pretty good, as well as it could be expected. I just started in late June, so I'm just trying to get the word out there and try to inform my community about oral health literacy and awareness and just tips and information. I actually started thinking about it while I was in school and I was seeing patients, because I realized that a lot of people don't know basic things that I would think that they would know, but it's not. Like, I just learned that don't assume that people know how to floss or know which toothbrush to choose or when to change it out. Yes.
We don't. Yeah.
So that's why I created this page.
Cool. And that's like, so you entered the whole creator space. Like, that's a whole different ballgame. Because,
Yes.
like, I mean, on one side, I mean, you're coming from the perspective of a dental professional, but you're entering the creator space. So that's cool, because, like, that's its own thing. Some people just do that for a living, where they just post stuff, or like a chihuahua, like you were talking about, with a hat.
Yes.
And that's all they do. So, like, have you ever had, has that ever happened to you where, like, because I know stuff has happened to us. Like, I remember one time I was trying to record something for the podcast by myself. And then in the background, like, there was, and that's because they never come through here, but there was like an ice cream truck. So I was like, elotes. And I was like, oh man. Like, so I had to restart that whole clip. Have you ever had problems like with recording, like your dog barks or something?
Yes, sometimes
It
the
happens,
AC,
right?
because where I'm located in the house, the AC will turn on and you can hear it like turn on compared to dead silence. Or sometimes my parents are in the background, so I've already warned them, and I'm like, I'm gonna record, so be quiet.
To the whole house?
Yes.
Yeah. Yeah, I mean, one time, like, calling my wife out. One time I was recording something else, and then, like, well, this is my fault, because our apartment makes like a beep noise, and I like that when the door opens, so I know if somebody came in.
Yeah.
But it's not good when you have a podcast. So anyway, so like, she came in from work, and it's like beep, and then she's like, baby, baby. Like, she wanted to like tell me her story, and I was like getting all like in the podcast mode. But that kind of just comes with the territory, right? Like, and
Yes.
it's like, oh man. And then, like, when you post, like, you hope that like people are appreciative, because it takes a lot of work, right? Like,
Yes,
it could
definitely.
be like a 15-second clip, or like a 30-second video with like a little paragraph of a story, but there's hours behind that
Yes,
post,
most
right?
definitely. Yes. And you want to make sure that you are getting all the proper information. Some of the stuff I get from, government websites, the research behind it. So, I mean, some of the stuff, yes, I know, but it's good to have backup information, because a lot of people are like, well, we want to read up on that. So
That keeps you sharp, though, right? Because
Yes.
you're keeping up to date with the latest. Like, you gotta like check out the journals and everything.
Yes.
For the education part.
yes, I'm always taking continued education courses. Yes, they are required by law,
law,
for
yeah.
our to renew our license, but I'm
Yeah.
always trying to get like different different areas of the field. Like, even if I'm like, I might not need it, I'm like, you know what? Like, it's going to benefit me in some way, even if I learn one thing. Like, for instance, I just listened to one a few weeks ago about sleep apnea, and we can actually kind of tell some signs about that in the dental chair when our patients are in the dental chair.
Like, you can tell that somebody might have sleep apnea?
Yes.
Okay. Well, tell us about that.
Yeah, so one sign is grinding or clenching if the patient suffers from that. Another sign is an enlarged tongue. And another sign is scalloped tongue. So basically the sides of the tongue are kind of like scallopy. They're kind of wavy like. And also if we can see down your throat, like how much we can see. And if we can't see at all, that's for sure a sign. Or also if when the patient is reclined back, that they're struggling to breathe, or they kind of make like a gasping noise. And that's another sign. So
wow, so you can do like screening for that just as you're doing like your normal stuff.
yes.
Wow. Okay, guys, moral of the story, like, check your tongues. Right? Check if it's white. Check if it has did you say scallop?
Scalloped, yes.
It made me think of like taco tongue when we would do that as kids.
Oh
like,
yeah, it kind of does look like that, but on the sides.
really?
Yeah.
Okay. Can you make your? I could never make like a
No,
taco.
I cannot.
Me neither. Like,
No, and I
was
can't do the
only-
cherry thing either.
I mean,
The
I was the
cherry
only
stuff.
one, like in my graduating class, because like all the seniors were doing it one day. I was the only one who couldn't do it, and I
Yes.
felt so dumb. Yes, like that. Like my wife is doing it right now.
Yeah.
But if you see the taco tongue in when you're doing like an assessment or a cleaning, that's like could be a sign of sleep apnea, right? So I guess that's
Yes.
the first time that I'm happy that I don't do that.
The scallop tongue, yes.
Scallop tongue, yeah,
Yes,
yeah.
yes.
Okay, yeah, I said taco tongue. Yeah. Okay, yeah, no, that's misinformation, guys. I'm
Yeah.
sorry. That's why I'm not the dental hygienist here. I have a question, just because I'm just curious, because like for what I do in healthcare, I kind of do this too. So I'm just wondering, do you ever like? I'm not gonna say judge. Do you ever secretly evaluate like your friends' teeth when they're talking to you and stuff like that?
Oh, most definitely.
Yeah, without them knowing, like you're.
Yeah. No, a lot of family and friends that they're with me and they know me, and they'll be like, stop looking at their teeth. Stop.
They can see you doing it.
Yes, and I'm like, I try not to make it obvious, but I've always been the person, even before I became a hygienist, I'll tell you if something's in your teeth. Because I would want to know if something was in my teeth. So I always tell somebody like, hey, I have a little something right here. So
you're secretly like assessing them like when they're talking to you and
kind
everything?
of, yeah.
Have you ever
sometimes.
like not like you weren't paying attention to what you were being told because you were looking at their mouth or something? Like,
No, I don't think it's that bad.
no.
But
Okay. Yeah, because I know that I think everybody does that though, right? Like when in their own, whatever that means to them, like in their own career. Like a
Yes.
cop is always going to be like looking around, right? A doctor's always going to be like, that mole looks kind of funny. Like
Yes.
they're like paying for like their milk at the store. They're the cashier, like your
Yes.
throat looks a little funny. That
yeah.
might be a goiter there. So I can imagine, but it's funny because we all do it like secretly. Like no one even knows.
Yes.
Like that you're actually like, and like I said, it's not judging, and it's kind of like you can't really help it either, right?
Because you do it on a daily basis.
Yeah, like, you're not
several
trying
times a
to.
day. Mhm.
Yeah, like it's not your fault. Like
No.
you're not trying to check for their scallop tongue, right?
Yeah.
It just kind of happens like that. That's funny. I had a feeling. I was like, man, when you came in, I was like, I gotta make sure. I didn't even prepare for this, but I was like at work today. I was like, should I like brush my teeth before she comes? For real, like I was in my office thinking like, okay, like where's my floss? Like how's my plaque? Because then she's gonna come in and like start schooling us, which is what, like I said, that's what we need anyway. But that's cool. I like that. I like the honesty. Okay, so right now I just want to do this. This is not part of the plan, but I have 3 strips here that I'm gonna put us all on the spot here in the room. So I got my brother and my wife off mic, and I'm gonna do this too. A little side note or disclaimer: I did not floss this morning, or I didn't do, or before Arianna came in, I didn't prep, and I know they didn't either because they didn't know this was gonna happen. So we're gonna spend a few seconds. We're gonna see who had the least amount of stuff in their mouth. So if you guys can give us like about 5 seconds, we're gonna do a little sweep and hopefully see who wins this battle. Let's go, guys.
Go all the way to the
Let's
back
floss.
teeth. Go
Let's
to
do
the
it.
back teeth.
Let's do
Those
it.
are the most.
Let's do it. So Derek is asking how to use it. First of all, he wants to know how to floss.
Oh my
So I think we might know who's gonna lose. If it's a string, I get I can do this. But this is yeah. So we're actually holding sticks. It's like a floss stick. So here we go. All right, guys.
Pick. Yeah,
round
floss
2.
Pick. Mm-hmm.
Floss pick.
Yes.
Here we go.
I put it in and I just do this. And you like angle it towards the back and then towards the front of your mouth, like a C shape.
Derek is learning off mic how to do it. I'm currently flossing right now. Put it in here and do this.
Yes, and then you angle it, like push. No, you kind of just do it. Just do it as best as you could. Go watch my videos.
Arianna's having a good time right now. She's the only one not under pressure. No, she's having anxiety because we're doing it wrong. All right, guys, how do we do? All right, that's good for now. It was just a little test run. All right, that's it. Let's see our results.
Sam has a little meat there. Ooh, Ali's good. A little bit for Derek. I think Sam has the most.
What? Oh no!
Look at that big chunk.
I know I had a big piece of. I don't know, dude. I had pasta today. Well, you know what? I was flossing the most.
Yeah, that's true.
Oh, okay. Okay, so, all right. I guess our little experiment backfired on me because I ended up having the most that I needed to floss, which is good. I mean, we all did our daily flossing. Both my wife and Derek are still going at it. I stopped like 2 minutes ago, but this guy has like, yeah, they're busy right now. So okay, fine. I'm the loser. I'll take the loss. So okay. So anything else that you wanted to add? I know we just talked about going to the dentist regularly. Anything that we need to know?
I think just I want to normalize going to the dentist not only when you're in pain. And I understand not everybody might not have insurance, but for the ones that do have insurance, like go take advantage of that and use up your benefits. I feel like our culture only goes when they're in pain. And a lot of these things, if you go on a regular basis, they can be prevented and because they're caught early enough with the x-rays and stuff like that. So, and it'll also cost you less money in the end because if you get a little minor filling, which can cost a few $100 compared to waiting a few years or even months sometimes, depending on how severe the case is, it can end up being a root canal, a crown, or an extraction. And root canals and crowns together can cost over $2,000. Instead of paying a few $1,000s, you can pay about $300 for a filling. And, that's going to save a lot of money. And, it'll take care of you overall in your oral health. Okay,
so it's like you got to get ahead of the game. And before you get to the thousands of dollars range.
Yes. And I know a lot of people are like, oh, dentistry is so expensive. But most of the time, like I said, these things can be caught early and they're not caught early because, like I said, they go only when they're in pain. And it's already too late at that point most of the time.
Okay, thank you for telling us that. Because, yeah, that's another thing that we did need to hear, especially because it's usually like a Saturday morning emergency run to Mexico. That's like... We wait until it gets that bad, right? When like we can't take it anymore.
Yes.
So what do you think about this whole Valley thing about everybody going to Mexico to get their dental work done? Do you have like a take on that?
Yes. I'm not totally against it. Just make sure you know who you're going to. Make sure they're reliable and they're trustworthy, and make sure that they do have their license in the U.S. because there are some dentists that practice in Mexico, but they were licensed by the U.S. first. Like they went to school here and everything.
So you got to know who your dentist is, basically, right? Like,
yes.
Just make sure you know.
Don't get me wrong. I'm not against like
going to Mexico. It's like, a lot cheaper, man.
Yes.
You can't deny that. It's so much but for people that don't have insurance. It's cheaper
for the wrong reasons.
Yeah, that's true. So yeah, I mean, basically just like know who you're working with, right? Because in the world of surgery, man, that happens all the time too. Like people get sent over here because of some work that was done over there, and we get kind of like the dirty work, the fixer-upper jobs. But yeah, so I mean, I guess it's just a matter of like who you're with, right? Like you got to know.
Yes.
You gotta, if you want to trust them. All right, so man, this has been a good conversation so far. But there's one thing that we haven't really touched on yet. For everyone listening, I mean, we might not be aware, but is it true that Because we've talked a lot about why it's important to keep, flossing, brush our teeth, whatever. Is it true that our dental hygiene or like the importance of keeping our mouths clean goes further than just the mouth? Like it's more of a systemic issue. Is that true?
Yes, most definitely. I like to stress that on my page a lot. So down here in the RGV, there's a high prevalence of diabetes, of course, and high blood pressure and high cholesterol. So all that stuff correlates with your oral health and your systemic health correlate together. There's a relationship between there. For instance, uncontrolled diabetes, it's a poor immune system, a poor healing system, which affects your gums. So if you have uncontrolled diabetes, you are at a higher risk of having periodontal disease. And also the oral bacteria in your mouth has been linked to strokes, heart disease, and even Alzheimer's.
Oh, wow. So it really is way further than just the teeth.
Yes, it's more than cavities and periodontal disease.
Okay. And so, I mean, if that's the case, if we're talking about like our whole body, how often should we be taking care of our teeth then? Because that's important.
Yes, at least twice a year. Some people can even push it once a year, but it all depends. And we even have some patients that need to come in every 2 to 3 months. So we're not trying to rip you off or anything like that. If you are bleeding and we do see your probing numbers are not where they want to be or where they're supposed to be, we do recommend they come in every 2 to 3 months just so we can focus on those areas, like go back to, reiterating what we went over with your education and stuff like that and your diet and just making sure you get back on track.
I want to do something with you. I've never done this before, but I want to do some speed rounds with you.
Okay.
Okay. Little disclaimer. We kind of reviewed of some of the stuff we talk about, but she doesn't know what I'm going to ask her right now.
Oh my gosh. Okay.
So
I'm ready.
Hopefully this is fun. We'll start easy. What's your favorite toothbrush? No, I said that wrong. What's your favorite toothpaste brand?
Sensodyne.
Easy. Okay. Favorite color scrubs?
Probably like a turquoise aqua.
Okay. What's worse? 1 week not brushing or not flossing?
Not brushing.
Okay. In the morning, this is just personal. Coffee or tea?
I call it fake coffee because I always get like the white chocolate mocha from Starbucks. So
Okay.
It's all sugar. I know that's bad, right? But I don't drink straight coffee.
White chocolate mocha.
Yes.
Okay. You know where to get her, guys.
Yes. Starbucks gift card.
I know, right? Yeah, don't even get the mocha. Just get the gift card. Okay. Favorite mouthwash?
Their breath.
TheraBreath?
Yeah, it's THER and then breath. ERA, sorry, breath.
Is that like at Walmart and stuff? HEB?
Yes, at HEB, Walmart, even Walgreens. They have a very long line of mouth rinses.
Oh, I thought you meant like they have a long line. Like don't go to Walgreens because you're never gonna get out of there. Okay, TheraBrush, right? Oh no, TheraBreath. Oh, that makes sense. It's breath, right?
Yes.
Yeah, man. I'm sorry. Okay, are you a morning person or a night owl?
It depends.
That's hard, right?
Yes, it depends. I can do both, but my family might say otherwise. But if I know I need to wake up for something, like for work or an event, like Teen Mom, I had to wake up super early. I had to be there, I think, at 5:30. And I already knew what I was going to do. I was excited. So I was like ready to go. But then there's times where I'm like, if I know I don't work tomorrow, so I'm going to sleep in until like 11.
Okay, so you can do that too.
Yes.
Okay. So let me ask you another question. Or let me rephrase that. If I were to ask your family, is Arianna a morning person or a night owl, what would they say?
They'd probably say neither because I also am a napper a lot. So
me too.
I take a lot of naps.
That's good for you though. Like it feels good though, right?
For me, but they're always saying otherwise. So,
but you know that like we shouldn't nap for a long time. Though,
I know,
right?
but I do.
Yeah, because like that's bad. Like if you go through like the whole sleep cycle, like once you hit 90 minutes, that's like if you sleep for an hour and a half, that's actually bad because it's like you slept an hour and a half. Like you're supposed to get 8 hours.
Yes.
So your body doesn't know you're napping. It's like you're supposed to sleep like 20, 25 minutes, but it's hard for me to take a power nap because I just don't wake up.
Yes, I know exactly how you feel.
Or even if I could wake up, I don't want to wake up at 25 minutes.
Yeah.
But the research says we should. But anyway, that's something else. But yeah, okay. I like the nap thing. That's cool. Me too. But of course, like a lot of times we don't have the time to nap because we're working and
yes,
you know how that goes. Okay. Are you a Swiftie?
No.
That was fast.
Nope.
Okay, that speaks for itself. Worst food for dental health.
Ooh, chamoy and trechas and all that. All that stuff that my community loves and I love too. I'm guilty, but that's probably the worst.
Okay, you know what? We're gonna have to put a pause on this
Hot
speed.
Cheetos and chamoy and yep.
Okay, you guys, cut the speed around. We're gonna stop here. Why did you say chamoy? Like that was quick. Like why is that the worst food for dental health?
It's very acidic, very, very acidic, and it has a lot of sugar. And I just say that a lot because our community, that's what we like to eat. All the hot Cheetos, takis, chamoy, trechas, we put in our fruit and everything. And most of the time, we're not consuming it in less than 30 minutes. We're going to be snacking for a good few hours. So that's even worse. Also, tip, whenever you do eat bad stuff or junk food, you want to limit it to like 30 minutes. And afterwards, do not brush your teeth. That's key. Do not brush your teeth until 30 minutes to an hour after you eat in general. Because think about it. You have all this acid on your teeth, the sugar, bacteria, and you're brushing it. So it's kind of like brushing it into your teeth. So we want our saliva to do its job and wash away and break down all the particles and stuff. So yes, wait 30 minutes to an hour to brush your teeth, which a lot of people do not know that.
Okay, so that's interesting because there are some people that are in the morning, they're after breakfast brushers. So
Yes.
is that bad?
Yes, you need to wait 30 minutes to an hour, preferably an hour, but at least 30 minutes.
Okay, so if you're gonna be the after breakfast brusher, just do it after half an hour.
Yes.
Okay, is it better to do that though? Because like, I'll put myself on the spot. I brush before, like I brush first thing in the morning. Is that what we're supposed to do, or does it matter?
That's what you're supposed to do because, and I'm actually going to do a video about that. They've done pH testing as soon as you wake up. And that's when they recommend to do it instead of, because most of the time it's a little off of what it's supposed to be. So they say to brush immediately after waking up and not waiting even like 30 minutes.
Okay.
So I was actually going to do a test on that.
Oh, good. So, kind of caught my attention. You mentioned like the reason why the hot stuff was bad. You said because of acidity. So like we're literally corroding our teeth. Like it's the acid is eating at the teeth.
Correct.
That sounds horrible.
Yes. So that's why we need to protect it. And whenever you do eat junk food, also rinse with water or drink a little bit of water just to kind of wash away some of it. Of course, it's not going to do all of it, but yes, just do that and then wait the 30 minutes to brush.
Okay. And then I want to backtrack to, we already left the speed around thing. You're safe. You said that Sensodyne was your favorite toothpaste. Did you ever do a thing where like you just like had a whole bunch of different ones and tried them out, or like?
Yes, I have tried several ones. My favorite one so far from Sensodyne is probably the Intense Enamel Repair. And I know some people might be like anti-fluoride. So also Boca, B-O-K-A, is a great alternative. It has nanohydroxyapatite, which is also good for maintaining and keeping the minerals in your teeth.
Okay, that's good to know. Actually, I think we could take that tip. And so Sensodyne in general, those you like that?
Yes.
Sensodyne. Okay, cool. And you can. That's everywhere, right? Sensodyne?
Yes, Sensodyne is everywhere. And on the topic of toothpaste, stay away from charcoal toothpaste.
Why?
Because it's way too abrasive for your teeth.
Oh, that's what you're saying about the whole hard and everything. Okay.
So it's not just the bristles, but if your toothpaste is too abrasive, it's kind of the same thing. So toothpaste actually has, it's called an RDA level, and it's basically testing the abrasiveness of your toothpaste. So stay away from charcoal or like a lot of the whitening toothpaste. It actually says to only use for 2 weeks and then to stop.
Oh, yeah, I've seen that.
Yeah, so a lot of people don't know that either. They're like, oh, yeah, I've been using like Colgate Optic White for like the past 5 years. And I'm like, you're only supposed to use it for 2 weeks.
Oh, just the regular toothpaste, the whitening one. I thought you meant like specific whitening stuff.
No. Yeah, like some toothpaste are only designed to use for 2 weeks. And then you come back to it maybe a month later, you can use for another 2 weeks. But it's not for an everyday thing.
But like, I feel like at least like 70% of them say something about whitening. Like there's so many whitening toothpastes. But
Yeah.
they're not supposed to be like a long-term deal.
No, well, it's just like, you know how some of them are like immediate results in 2 or 3 days. Those are the ones that are more abrasive, and they also cost more, so you'll know right away.
Oh, yeah.
But like Sensodyne even has whitening toothpaste, but they're not as abrasive as other brands.
Okay. Okay, that's interesting. And so like with that charcoal stuff, I just thought about it right now because the charcoal toothpaste is meant to be whitening, right?
Yes.
Is that what it's for?
Yes, but a lot of people are, I guess, misinterpreting what it does exactly. So the enamel, which is the outer layer of our tooth, it's whitish color, right? Not everybody has super white teeth. Some people have, it's actually supposed to be like a yellowish hue. Some people have more gray tones.
As like a natural, like
Yes,
healthy.
as a natural, yes. And so that's white. So over time, yes, that charcoal toothpaste is scraping off the stain or whatever you have. But then it's also scraping away that white enamel layer. And underneath that is dentin, and dentin is yellow in color. So if you're taking off that white layer, the yellow over time in the long run, the yellow is going to be more exposed. So then you're going to have yellow teeth. And then people are going to be like, oh, well, I need to use the charcoal toothpaste more. So yeah.
It's a vicious cycle.
Yes. So in the short term, it might seem beneficial and be like, oh, look, I have such a pretty white, bright smile. But over time, it's going to catch up to you.
Okay, I'm glad you told me that because I know that when we got married, I got like some whitenings like before the wedding because I was like, we even tried like I think banana peels. Like we heard like
yes,
you've heard of that?
Yes.
So does that work though? Like banana? Because we like anecdotally, I guess like stories. We had Allie had a friend that she said that she had like rubbed banana peels on her mouth or on her teeth, and that it did make her smile brighter.
Yes. So I'm going to be honest, I haven't done that much research on that, but I do follow different hygienists and dentists, and one of them did say
like a hack?
Not to use it. Not to use it, not to do that. I forgot why, but yeah, I do need to look into that.
Okay, so yeah, let's stop using the banana peels.
Yes.
Right. Okay. Even though, and that's kind of scary because that means that sometimes if something is working to whiten, it's actually just because it's like cutting off a layer, right? Or something like that. That's what makes it white.
Yes.
That's horrible.
Yeah, because it's taking away the stain, but it's at the same time, it's taking away a little bit of your enamel.
So why do they sell those products? Like,
I have no idea. That's a question that everyone asks me, and I'm like, I don't know. I don't know why they sell hard toothbrushes or medium toothbrushes.
that bothers me a lot.
Yes, and
like,
also
why?
yes, and the oral hygiene kits that they sell at the store, like I don't know if you've ever seen it, has like a mirror, a little it's called their scalers. You're not supposed to use those either. Like we went to school for that. We're trained. There's certain ways to use it. A certain end might work on one side of the tooth and then the other end works on the other side of the tooth. And people don't know that. They're just like, oh, I think I'm doing a good job, but you could be damaging your gums.
Man, that's sad though, because it's like available. Like we think we're doing something good, right? Like,
yeah, but most of the time people do more damage than good.
Yeah, because like going back to that whole toothbrush thing, I had a friend, poor guy. It sounds sad now, but like, he thought like he needed the hard toothbrush because it was gonna like be more effective. And it's like the worst thing is that actually sounds illogical, right? Yes. Like because you're cleaning something, you got to get in there and scrub if you're washing dishes. But that's like the worst thing you want to do.
Yes.
The last thing you want to do. But I mean, like, of course, again, no one's gonna know if we're not told, and that's why I love your Instagram account. And you're on Facebook too now, right?
Yes. So on Facebook, I do have a different name. It's Arianna RDH. And then Instagram is the RGB RDH.
Okay. So let me ask you this. Is there any one like pet peeve that you have or something that like we absolutely need to know like about dental hygiene? Like it could be anything. And this is like off the top of your brain. I know we hadn't planned any of this, but like, is there anything that you wish the public knew? Like this is like an opportunity to tell us public announcement.
I got it. Either store your toothbrush in a different area from your as far away from your toilet as possible, or close the lid. Just please close the lid when you flush, because there's videos on YouTube that you can see. They use UV lights and all that stuff, and that stuff splatters everywhere, and the feces and stuff goes in your toothbrush, and then it goes in your mouth, and then back. It does the whole cycle again.
So you
I
like
mean, think about it. I mean, the
yeah.
bacteria goes through the rest of your body.
So we're scrubbing like fecal matter and bacteria
Yeah.
on our all over our mouth. Oh
Yes. So you want
no.
to, and also that's my number one thing. I'm always stressing that to either, I mean, just play it safe and just close the lid and then flush. Also, you're not supposed to store your toothbrush like with your spouses, your kids. You know how a lot of toothbrush holders,
Oh
they have
yeah.
like 4 or 5 different slots. So yeah, you're not supposed to put them together because the bacteria can actually jump from like one another.
It's alive, yeah.
Yes, so that, and don't put the little like the toothbrush travel cases.
Mm-hmm.
Some people put it on a daily basis even when they're at home. Don't do that because you're trapping that bacteria.
Don't do that.
Don't do that.
Okay.
Yeah. So, and when you are traveling, you want to dry your toothbrush as much as possible, and then you can put the case back on. But as soon as you get home, air it out because that bacteria continues to grow.
That's a good one. So thank you for telling us that. So like keep the toothbrushes away and then away from each other too.
Yes, away from each other. Don't share your toothbrush either.
Oh yeah, yeah. That's.
Oh, a lot of people do that.
Were you an only child too?
No, I do have an older brother.
Did you ever use your brother's toothbrush?
Ew, no.
Did you ever find out that he used yours?
I hope not. Now I'm gonna ask him after this, but he was one of the aggressive brushers. Remember
really?
how the brush? Oh my gosh, I remember since I was young, I would be like, "Why does your toothbrush look like that?" Like, and then he would brush super, super hard. So, yeah, now he has an electric toothbrush, so it controls most electric toothbrushes. There's a pressure sensor, so it'll tell you either stop or light up. Just to let you know, hey, you're putting too much pressure on your teeth.
Okay, good. So to recap on some of this educational stuff, give your coated tongue a week or two, right? And if it doesn't go away, go to the
dentist.
Go to the dentist. Keep your toothbrushes away from each other. Don't cap them. The chamoy one is gonna be taken with a grain of salt, but like it's not the best, right? It's gonna corrode. Is that correct? Corrode your teeth.
Yes. Mm-hmm.
Okay, and it literally does. And then stay away from the charcoal toothpaste.
Yes.
That's gonna save you money anyway, though, right? Because aren't they expensive? Like you said, like I've seen expensive
honestly,
stuff.
I've never bought one.
Well, good, right? Because you don't want to.
So I really don't know. I think there may be a few dollars more than a regular toothpaste, but I mean, there's so many different options out there for toothpaste, toothbrushes, mouth rinses. I try to stay up to date, but I'm like, oh my gosh, there's so many.
Yeah. So let me ask you this. What do you love about your job?
Interacting with my patients and educating them. That's my favorite part. So it's called oral hygiene instruction, or OHI. And that's me talking to them, asking them, how many times you brush a day? Are you flossing? What products are you using? And I just like to educate them, like, okay, this is how you're supposed to brush. This is how you're supposed to floss. You know what? Instead of using this toothpaste, why don't you try this one instead? And some people might be not necessarily allergic, but they're hypersensitive to certain products and certain toothpaste. Like I am, it's called SLS, sodium lauryl sulfate. I think I'm saying that right. So basically it creates kind of like a webby film throughout your mouth, and it like peels off. So it's kind of like a snake. I think of like a snake shedding. Mm-hmm. So it does that. And that means that you're sensitive to that ingredient in your toothpaste.
Okay. So if you get that film, that's bad.
Yeah. I mean, it's not really, really bad, but over time it can cause some negative, like,
so
harmful.
switch your toothpaste if that happens. Okay, that's good to know. All right, so you love like teaching and educating.
Yes,
which makes sense because you started your Instagram account.
Yes,
and we're all gonna follow her, right, guys?
Yes,
we're all gonna,
please.
after we check the mirror and we move our toothbrushes, we're gonna follow the RGV RDH. And
Correct.
on Facebook, what was your name?
Arianna RDH.
There we go. Okay, and then last question: what do you love about the Rio Grande Valley?
That we're tight-knit and we're a community and we're willing to help each other out for anything and everything. We know we're always lending a helping hand. Yeah,
we are always lending a helping hand as a valley, right? That's awesome because that's how it should be, right?
Yes.
That's like fundamental stuff. And it's a different world. You have to be here to experience like the closeness where you can like everybody's your grandma, like
yes,
that feeling. That's awesome. Okay, well, Um, we got some homework now to do, guys. First of all, switch your toothbrushes if it's been more than 3 months. And if you don't remember how long it's been, it probably has been.
Yes, exactly. That's always what I say.
Yeah, or if it looks like I had a bad hair day. So thank you for being here. Honestly, I think that this is going to be very helpful to us. We learned a lot. I know that we all of us here in this room just did. And it's like fundamental things, but we got to hear it. And then one more thing, happy Dental Hygienist Month, Dental Hygiene Month.
Thank you.
You told me
yes.
about I didn't know about it, so I'm not going to act like I knew it. But it's October, right?
Yes, October is National Dental Hygiene Month. So just reiterating brushing twice a day, flossing, especially at nighttime, visiting your dentist/dental hygienist twice a year or more times if recommended, and just eating healthy.
All right, so we got a lot to think about, a lot of homework to do. We're gonna have to really dissect this conversation, and I mentioned it earlier, but now that Ali and Derek are here with us, on the count of three, guys, we're all gonna say Happy Dental Hygiene Month. Okay, ready? 1, 2, 3. Happy Dental Hygiene Month.
Whoa!
Yeah, October. One more reason to love October.
Yep.
So thanks for spending some time with us. We really had a good time. It's like something that's gonna directly I'm gonna think about a lot of this stuff, like from the fact that I lost this whole flossing challenge. Yeah, guys, it's just one more reason to take care of our dental health. Part of the purpose of this show is to make the valley better. Part of that is making it healthier. So thank you for your work in doing that. Miss Arianna is doing a lot to help us be healthier people. And like we just learned, it's a lot more than just our teeth. So if you take care of your mouth, you'll take care of your body.
Yes.
So thank you for that. Honestly, from the bottom of our hearts, we appreciate it.
Yes, thank you so much. And thank you so much for having me. I enjoyed talking to you all and educating the public. And don't forget to follow me on Instagram at the RGVRDH and on Facebook at Arianna RDH.
There we go. All right, guys. Well, follow the show. Follow it on Instagram. Follow Arianna. And we'll see you guys next week. Have a good week. Say no to drugs. And make sure you brush and floss. Bye. Thanks for spending some time with us today. Don't forget to follow the show on social media for updates on episodes, interactive content, and more opportunities to grow together. We'll see you again next week on your podcast, The Real Grand Podcast. Stay safe.